Hello, folks. This is Joe Biden, and I'd like to take a moment to talk to you about something very important to me and, quite frankly, important to all of us. For decades, presidents from both parties have worked to reform the healthcare system. FDR went so far as to call it a fundamental right for all Americans.
Certain economic truths have become accepted as self-evident. The right to adequate medical care and the opportunity to achieve and enjoy good health.
I know and you know, forever in Washington, they kept coming up short on solutions to the health insurance problem. The American people paid the price, costs kept going up, and health care coverage was denied to those who needed it most, and there were fewer choices. President Obama was determined to change that and to make reform a reality.
Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.
Right after being sworn in, we began the effort to gain consensus on health reform. For example, in March of 2009, we held the first White House Forum on Health Reform, where we heard from doctors, nurses, members of Congress, patients, and my dear friend, the late Ted Kennedy, all making the case for reform.
I'm looking forward to being a foot soldier in this undertaking, and this time we will not fail. Thank you very much.
Teddy's passion, his life's work, was to make sure that all Americans had access to decent, affordable health care. And he never gave up, and neither did President Obama. And when some suggested that the president should back off, give up, he reminded us just what was at stake.
Everyone in this room knows what will happen if we do nothing. Our deficit will grow, more families will go bankrupt, more businesses will close. More Americans will lose their coverage when they are sick and need it the most, and more will die as a result. We know these things to be true. That is why we cannot fail, because there are too many Americans counting on us to succeed.
And on March 23, 2010, President Obama delivered on his commitment, signing the health care bill into law, giving the American people more freedom and control over their health care choices, improving the quality of the care that they receive, and reducing cost, all by building on the best of our private insurance system. Before we passed this health care reform, we heard from legions of small business owners struggling to do the right thing, keep their employees on the payroll while also providing them with decent health insurance coverage. But it was difficult. Now that's changed. People like small business owner Jim Hauser in Oregon, they now have relief. Jim owns an auto repair shop, and thanks to the law, he's going to get a tax credit to make it easier to provide for health insurance to all his employees. We heard about a young woman, Kayla Holstrom, in South Dakota, suffering from a chronic bone infection, a so-called pre-existing condition. And in 2014, when the law is fully in effect, no one like Kayla, anyone of her age, will be denied coverage because they have a pre-existing condition. In fact, no one of any age can be denied coverage because of a pre-existing condition. We heard about seniors on Medicare like Paul Horn in Indiana. He couldn't afford the annual physical that he needed and was struggling to pay for his prescription drugs. Now, because of the law that we passed, people like Paul can get a free annual physical, and nearly 4 million seniors, including Paul, received $250 in the mail to help them pay for and afford their prescriptions. Your insurer now has to spend more of the dollars you pay them in premiums on medical care, not on salaries and overhead and advertising. States have new resources to track and crack down on unreasonable premium hikes. And we're implementing a patient's bill of rights to end the worst of insurance company abuses, like preventing insurers from dropping you when you get sick because of a simple mistake in an application, protecting in the process more than 15 million more Americans. Look, folks, healthcare coverage can be confusing. And that's why we set up a website that's easy to use and puts all the information you need in one place. The website is at healthcare.gov. Now look, this all has happened in just 1 year. It's only just beginning. It's only going to get better each year until the law is fully implemented in 2014. And to learn more about what's to come, head over to that website, healthcare.gov. to find out how this law is already making a difference for tens of millions of Americans and how it will make a difference for you.